Cranial navigation uses either an MRI or a CT, mostly an MRI, and that image is taken and overlaid essentially onto the patient. We are able to use each patient's unique findings to help plan for surgery. When we do cases in the brain, especially cases that involve the removal of brain tumors, for instance, think of the cranial navigation as a way to essentially see through the head and to look into the brain to ensure that we are safe for our patients and to ensure that our outcomes clinically are, excellent. Cranial navigation can be very helpful for other neurosurgical cases. For example, if you had to place a shunt, which is a tube that goes into the brain to help drain fluid to decrease pressure in the brain, you can use the navigation to help direct where that catheter needs to go, which can be very helpful for certain surgeries like a microvascular decompression. Cranial navigation allows you to, plan where your craniotomy needs to go, so you're protecting venous structures and the nerves, and allowing you to be, again, very accurate in terms of how you need to perform the surgery. It can also be used for other vascular neurosurgical procedures and also functional neurosurgical procedures, for example, placing deep brain electrodes for Parkinson's. With the advance in technology for different tools that we use for cranial navigation, it's allowed the systems to be more accurate in terms of identifying where tumors are. Even better, depending on where the tumor is located, if it's in a tough or tricky spot, you have a surgeon who's well trained in these particular conditions, and you are giving them that extra tool to be even better to ensure that they're getting the excellent care that they deserve when they come to UPMC.